Everyone. Today we have a 38-year-old male with no past medical history who presents to you for evaluation of a tick bite. The patient states he was hiking in the woods 5 days ago. When he came home that day, he noticed a tick attached to his forearm, which he removed. He believes that the tick was attached for about 12 hours. Patient's currently asymptomatic and denies any rashes. He brought the tick with him and a picture is attached. Which of the following is the most appropriate? Hey everyone, welcome back to MedComplete Board Review. So the answer to the previous question that we posted about the 38-year-old male who noticed a tick bite about 5 days ago is F, reassure without treatment. So whenever you see someone with a tick bite, either on the boards or in real life, it's very important that we understand a few key principles. Number one, we have to understand that tick bite, it does not equate to infection. Okay, they're not exactly the same. Not every tick bite equates to transmission of disease. Okay, so there's only a few specific situations in which a tick bite would transmit disease, and it's important that you not only recognize this tick by its description, so it's the Exodus tear tick, you have to recognize the name and you have to know what it looks like. Okay, so either one can be fair game on your tests. Okay, so this tick transmits Lyme, it transmits babesiosis, and it transmits anaplasmosis. So it's important for you to remember all these things. But the most commonly tested one is Lyme, obviously, because it's the most commonly transmitted. So if somebody comes in with a tick bite, you have to meet a few criteria in order for us to be concerned enough to give you prophylaxis. Number one, you have to identify the tick and know that it's the Exodus tick. Number two, the tick has to be attached for 36 hours or more. Why is that? Because in order for the tick to transmit disease, it has to undergo a blood meal. And that usually takes the tick about 36 hours. So for us, either if the patient thinks that the attachment has been there for more than 36 hours, like that's their estimation, or if you see that the tick is engorged. So engorgement of the tick is equivalent to it having a meal, and that's equivalent to you saying it's been there for more than 36 hours. So either one of those is okay. And the prophylaxis that we would give must be given within 72 hours of the tick bite. That's very important here. So this patient was in the woods 5 days ago. We assume that that's when the tick bite occurred. And even if you give it to him now, the prophylaxis, it would not give him any benefit. It has to be within 72 hours. And the recommended dose is doxycycline 1 time, 200 milligrams 1 time. That's the recommended prophylactic dose. All right. So for our patient, not only is the tick not attached long enough, but he presented too late to benefit from the treatment. Okay, so that's why the answer is F. But guys, it's very important that you pay attention to this question, because all it could have taken is a few changes in a few variables here, and the answer could have just as easily been B. So if they said that the attachment of the tick was 40 hours and the patient presented 1 day ago to the woods, then the answer would be B. Okay, so be very careful with the details here. It's very, very tricky. The other thing is doxycycline for 14 to 21 days. This is the answer choice for treatment of acute Lyme infection. So if this patient presented to you and had the classic target rash, the erythema migricans, that would be doxycycline 14 to 21 days would have been the answer. Okay, ceftriaxone, it's very important to remember this. We will do another question on this later. This is the treatment of choice for cardiac Lyme or CNS Lyme. So this is the patient that has a tick bite, then develops like third-degree AV block or high-grade AV block. They're going to ask you, what do you give him? Doxy will be there. It'll be the wrong answer. Doxycycline does not penetrate the myocardium, does not work on cardiac Lyme. So in that situation, you would use ceftriaxone for those patients. Okay. Amoxicillin is the treatment of choice in pregnant patients. So in pregnant patients, obviously we cannot give doxy. It's teratogenic. So in that situation, you would pick amoxicillin, but obviously in this case, it would not apply. That's why it's the wrong answer. Azithromycin is third line. So macrolides are third line for patients that have a contraindication to doxy, and let's say they're allergic to amoxicillin, then you would give azithro, but it's not as effective as the previous two. All right. I hope you found this helpful. Please comment your questions in the section below.